annual event or academic event, but also these kind of conferences, collaborations, exchange of ideas, participation of stakeholders will transform the cause that we are working for. And more particularly for the students, it gives a wide range of knowledge and kind of motivation, and also it works as a part of their curriculum. So I welcome you all to KLU University, the university which is hosting today's conference, and also welcome to the land on the banks of sacred Krishna, and also to the city Amaravati, write it on the wall. Down the lane, maybe 10 years, you will get to hear that Amaravati is the #1 international capital that is built with the international standards. Just twice, when they were taking my name, twice they said Dr. Satya Kumar. For a moment, I felt happy that what I wanted to become in a life, I could not become. But fortunate enough that I got an opportunity to work with those doctors who I always wanted to be. It is not my ambition. In fact, my sister had ambition to make me a doctor. Of course, we lost her to cancer. With an engineering background and political science background, and right from student days, always been active in student politics. Ever since I have become minister, I feel myself as an illiterate. Even now outside, when these biomedical engineers were explaining me about the new innovations, catheters, phototherapy and all, I was pretending as if I knew about all this before itself. When Dr. Anil Garu came to my rescue, and Dr. Srinivas Reddy also came to my rescue, saying, sir, ఇవన్నీ మన హాస్పిటల్లో ఉన్నాయి సార్, ఈ వార్మర్స్, ఫోటోథెరపీస్ అన్ని మన దగ్గర ఉన్నాయి. Such is a complex subject the medical health is. I'm still struggling even after becoming, just yesterday, 2 years ago, assumed office as a health minister. It's been 2 years ever since I've been functioning as a minister. But still, I'm a student. Every day I get to hear about some new terminology and new things. See, I don't say that maybe I know what I know is a drop in a ocean, but still I work hard. At times I wonder, had I worked that hard when I was in college, I would have become either doctor or maybe would have cracked the toughest competitive exams UPSC also. But when I was in college, I was always backbencher. I was aspiring to become a minister for rural development. For I worked as a OSD to the Union Rural Development Minister or Urban Development Minister. Even I worked Division Urban Development Minister, OSD to the Urban Development Minister as a OSD. Then even to the Vice President of India for some time as a OSD. But even in wildest dreams of mine, I never thought I would become health minister. I would say I'm not repenting, I would say that's a fortunate thing that God has given to me, because that's how I'm getting to learn about what life is. And I'm getting to learn about the greatness of doctors. For the Creator gives lives only once. but the doctor preserves that life for lifetime. Yes, today morning I had a press conference because we completed 2 years in office. We are reporting back to the people for they have blessed us and made us to sit in the place. I also gave a report 2 hour long press conference. Had to brief what the transformation that has happened in the healthcare sector, how there is improvement in quality healthcare services delivery, how we are bridging the urban-rural divide when it comes to healthcare, all kinds of these things. Then suddenly, then my PA reminded me, sir, there is a neonatal conference, we should go. I first asked him, what is neonatal? Of course, I get it. I'm hearing about it. But it's totally new subject. Totally new subject. And in this particular hall, this is my fourth or fifth visit. I always visited here as a national secretary of BJP for some political speech, for some social cause. For the first time, I'm here as a health minister to address the distinguished gathering who have devoted their lives to save newborns, the most vulnerable section among us, the newborns. Of course, I always previously also had a complaint about this hall. Even today, I have a complaint about this hall. I always kept on telling them, don't go for such a tall podium. They never gave a heed to my, because such a tall podium must maybe I will be audible but not visible at times. And added to that, they have kept some flavors also. This. They was trying to understand what is neonatology. And my DME said, asked him, DME Garu, what is neonatology? He said, sir, I have a given note. I said, ask my PA. It was 50-page note. 50-page note. I wondered where the hell I would I get such time for. Again, I have to rush to my constituency now after meeting certain appointments and all. Then I said, no, simply tell me what is neonatology. Then he said, this is a neonatology period is first 28 days. Then I thought, yes, 28 days is a very crucial, very fragile, very important phase in the human life. So, reason could be anything, so prematurity or some other having anemia or some congenital anomalies or some infections or diseases. But saving the kid, newborn, in 28 days determines the future of that child. Whether he will learn, whether first he will survive, or whether he thrives, whether he learns, or whether he builds his future and thus building a future of the family or society for that matter. Even for economic development of any family, any nation, the one being a healthy is most important because there is a direct and integral relationship between the health of an individual and economic development of any family or society or the nation for that matter. That's how it assumes very significance, very importance, neonatology. Saving the newborn in first 28 days is very important. That's what my DME was telling me. And next time, I tell my DME, next time onwards, DME garu, don't give me 50-page, 100-page note. Just give me 1-page note so that I can understand it easier and also present it because it's all distinguished, your subject experts. So presentation also matters. That's the reason why immediately after entering the hall, I said, perhaps I'm the only non-doctor here. There is a lot of progress when it comes to reducing neomortality rate. Mallikarjun was telling He gave a different numbers. Then Ramarao Garu gave a different numbers, and Mayor gave different numbers. But I then was just searching because you have AI tool now. Anything on the earth you can get on your phone. Just natality rate in India. Then it said yes, there is a much progress. In 1990s, it used to be 56, 57 on average, national average. It has come down to 17 to 18. And with the Honorable Prime Minister's initiative of Newborn Action Plan in 2015, it is making a considerable progress and in reducing the neo mortality rate. But still, the irony is that neo mortality death rate accounts for almost two-thirds of IMR. Two-thirds of IMR. So the more we focus on reducing neo mortality death rate, the more we are building a possibility of we building a healthy nation. That's how it assumes very important. In Andhra Pradesh, of course, we are making every effort. We could bring a lot of transformation in healthcare sector, right from primary to secondary to tertiary. I'm not going to bother you all about what we have done in the past 2 years, but when in the pertinent to note is that we could bring the IMR from 46.8 to 36 in the past year. That's our achievement of Andhra Pradesh Health Ministry and government under the visionary leadership of Chandrababu Naidu Garu. The IMR rate has brought down by more than 10%. And similarly, no, there's MMR. MMR is 46 to 12. And IMR, it was 19. We could show some progress, but not much. Not very impressive, from 19 to 17. And similarly, the NMR also stands at 15, 16. And our target is the government of India's target under SDG is to bring down the NMR mortality to below single digit. And also we also aim to bring down NMR and MMR and also IMR below 10, below a single digit. Whether it could be 5, it could be, though we have an ambitious, Chief Minister has set up an ambitious target of bringing down IMR to 5 by 2047. 2047, by the time we celebrate centenary independence, we have a goal of making Andhra Pradesh a Swarna Andhra, a healthy, wealthy, and a happy Andhra Pradesh. Happy Andhra Pradesh. We are making every effort in that direction. Most particularly, we have SNCUs, 62 SNCUs. I'm very proud to say that we've added 8 SNCUs in the last year. There are 5 neonatal intensive care units. There are 162 neonatal stabilization centers and almost 32 rehabilitation centers where we rehabilitate 74,000 newborns in financial year 2025 to 26. In last 1 year, we could rehabilitate, that is the number. And of course, RBSK program, you all must be aware of, we are conducting a screening for almost 68 lakh people, right from those children who are in Anganwadi centers and also who study in government schools, who belong to the lower middle class or underprivileged families. Then we are conducting screening, and for the 4 delays, the deficiencies, diseases, defects, developmental delays, and we are also sending, if there are any developmental delays like cleft foot or cleft, we are sending them to DAC centers. In the past, RBSK, ever since the RBSK program has started, we could treat almost 20 lakh students for 4 Ds. That is also one of the achievements ever since the state has bifurcated, because state has bifurcated 12 years ago, 2014. That is the progress when it comes to RBSK. And similarly, many other initiatives are being taken to transform the overall healthcare sector from the primary to tertiary healthcare. But more the notable thing is that nowhere in the world, I'm saying this, you can underline, nowhere in the world any government has gone, because all these years we are adopting a conventional method of reactive, curative. Now we are shifting our focus from reactive, curative to preventive, predictive, and wellness approach. That is a mandate that has been given by the Honorable Chief Minister and the Prime Minister, and we are working in that direction. And we are being, instead of patient coming to the hospital, now we are sending our teams to our national, NMUs, to the villages, to the doorsteps of the people, and we are conducting 41 tests free, for more particularly keeping a focus on the biggest challenge, which has become a biggest challenge, non-communicable diseases. Now we are segregating people on the lines of, yes, normal, yes, keep them aside. Then comes the lower risk people, yes. Then comes medium risk, then high risk. Accordingly, then we provide, there is a follow-up action also, we provide them treatment, then we have built a digital platform called Sanjeevani. You know what is Sanjeevani is all about. Sanjeevani, then we integrate this data with the Sanjeevani, then automatically our doctor calls them, they provide telemedicine services, or required be, he goes there, to reduce the high-risk people to medium to low, then to normal. That is the idea. We have identified 10 diseases that have 80% disease burden in society, like hypertension, diabetes, CVD, CKDs, COPDs, or cancer. These are the mapping is also done. Telemedicine, or also suggest them to go for a lifestyle changes and changing food habits, because these are the two which are taking a toll on lives of the people. Cancer cases are an increase, so we want to bring it down. So these are the initiative that we are taking in the state of Andhra Pradesh. More particularly, the, you know what, the transformation that the technology is bringing in everyday life, more particularly in the healthcare sector. Outside also, I could see many new innovations, many new things, tools. And recently we held again, we are the first state in the country, and the government of India also said that Andhra Pradesh should be a role model for adopting a technology, integrating technology for bringing in improvements in the healthcare services delivery. See, we conducted a AP MedTech Innovation Challenge with the collaboration of Ratan Tata Innovation Hub, and forming a committee on applied technologies, and inviting many people who come with new solutions, new tools, new devices, for whether it is a diagnostic or for surgical interventions. Then almost we received 297 applications. Out of them, 18 companies were identified with 40 tools, and they were tested on pilot basis right from that corner of the state to the other corner of the state, in the rural areas, in urban areas, and also in tribal areas. There are many new tools which can detect TB with a small handle. Just you cough and it detects whether what scale you are on TB. Then retinopathy, and for cancer screening also. Cancer screening, we are conducting a free screening manually. We are sending our healthcare professionals. We are conducting screening manually with the new devices. We can detect, because there is a social stigma. People are, more particularly women, are not coming forward to the health facilities for cervical screening. सर्वाइकल सिंह, वन इज नेग्लिजेंस, ओके ठीक है, क्या होगा बाद में देखेंगे, जब आगा वो समय देखेंगे. दूसरा थिंग इज सोशल स्टिग्मा. वो क्या समझेगा, ये क्या समझेगा, लोग जाने से, हॉस्पिटल जाने में क्या है, क्या हो गया, इसका कॉस्ट, व्हाट हैपेंड टू हिज हेल्थ, दिस काइंड ऑफ थिंग, दैट्स दे आर नॉट कमिंग फॉरवर्ड. दैट्स हाउ वी आर एनकरेजिंग दिस टेक्नोलॉजी टू फाइंड न्यू टूल्स, न्यू सॉल्यूशंस फॉर इजी डिटेक्शन ऑफ दिस लाइफस्टाइल diseases. That is one of the achievements, friends. I thank you all for being here, because it's very important meeting, I feel, because every life of newborn saved. So you are preserving the future. You are also adding to the economic development of the nation. So now our state again. There is another thing also. Of course, Honorable Prime Minister keeps talking about because increasing the population. 20 years back, it was controlling population. Now we are in the mode of population management. We have also come up with a framework increasing, because our TFR is only 1.5. So to bring in a stability down the line, then we need to have 2.1 TFR. That is how we bought a framework. We are giving incentives. We are encouraging public also to go for more deliveries. We are encouraging normal deliveries. We are encouraging institutional deliveries. Accordingly, we are also training our health for CACP, for neonatal resuscitation. All these things, trainings are happening regularly. These are all part of strengthening and also creating a awareness among the people, so that the future, so that they will understand the future. We need to get demographic dividend instead of demographic debt. That is the idea. We are passing through inspiring times, and we have a visionary leader like Chandrababu Naidu Garu here, and also Prime Minister. I need not to tell. I'm not saying this because he's a now global leader. The Morning Consult, one organization. When it comes to popularity, for the past 4 years, Narendra Modi Garu is standing at the first place continuously for the past 4 years. I'm not saying this because he is among this amidst this global challenges, when every country's inflation is going up beyond 10, but our inflation is below 4. We could restrict it before 4, before 4, below 4. Sorry. So that is how it is happening. And recently I should share, because since a political activist, not much to speak on the subject. So I try to deviate a little bit. So recently I need to share my experience, what happened, because you are the doctors and you be knowing what is happening around the world. 2 years back, before becoming minister, some 2.5 years back, I had an opportunity to visit London along with my friend. So we had to go somewhere, then we got into the taxi, then I said, take me to Shoreditch. Then he said, the driver said, where do you have postal code? I said, I don't have postal code, but I can give you a location. I opened my phone, I gave it phone to him, open location, he gave it. He saw it, man, I know it, and I gave it my phone back. Then he asked, he seems to have pressed a wrong button. Then a photo saver popped up where I am shaking the hands of Modi. So then he said, man, give me the phone back. I said, why? No, you want location? He said, no. I saw the location, I know I will take you, but let me have a look at your phone. Then I said, why? Then asked me, was that Mr. Modi on your phone? I said, yes. Then let me have a look at it. Then my friend told me, caught my hand tight, then said, Anna, don't give. What if he runs away with the phone? I said, nothing will happen. Let him, if at all he wants to run away with the phone, 50,000 worth phone, let him run away. We can run away to India with 20 lakh worth car. Then I gave him phone. He saw. Then he said, man, you know him, how do you know him? I said, yeah, you see. Then again asked me, how do you know him? I said, I'm National Secretary of BJP also. So there are hardly 12 National Secretaries all over the country. Then I said, because he won't believe my size and all, you would say, what is this? You are National Secretary of BJP. I don't believe kind of, he's faking kind of thing. So I knew. So I expected all those. Then I said, I'm a worker of BJP. Then he said, man, you shook hands with Modi. I said, yeah, you can. What is this? This man is asking too many questions. I said, yes, you can see. Little irritatingly, I said, yes, you can see. Then he leaned back towards me, stretched his hand, and said, man, give me your hand. Then my friend again held my hand tight. Anna, what is this? This fellow seems to be Tedaga Unnadu. Till now he was asking your phone. Now he is asking your hand. Don't give. I said, sir, he could not take away my phone. Then what will happen to my hand? Then again I gave him hand. Then he shook my hand. Man, you shook the hands of Mr. Modi. Let me shake your hand. Let me have the pleasure of shaking the hands of Modi. He's a great leader, global leader. I wouldn't have surprised. Those words have come from the Pathur Ramanagaral, Mallikarjuna Garu, or somebody in the hall, or somebody, some well-wisher, or those who live in a country before they have seen the transformation that has been happened in the past 10 years, and the economic development, and people coming out of the poverty to the tune of 25 crores. I wouldn't have surprised. Had that words come from the nation, which has a friendly relation, bilateral relationship with us, I wouldn't have surprised. But those words have come from a person of the country who ruled us, ruined us, inculcated a sense of slavery in our minds, propagating that Indians cannot do anything. From that nation, the citizen of that nation, UK, a person says, your Prime Minister is a global leader, great leader. I had a goosebumps, because not as a BJP worker, but as a citizen of India, I had a goosebumps. That was happened. So that is the kind of leadership that we have. The only thing is we need to have motivation, we need to adopt new technologies, we need to motivate ourselves and also future generation, create awareness, and health stands first. Because as I told you, see, as a Prime Minister has a dream of making India a Vikasit Bharat, a number one or probably number two biggest economies of the world. Then my chief minister is making Andhra Pradesh a Swachh Andhra, a healthy, wealthy, happy Andhra Pradesh. If at all we want to make those dreams a reality, we want to achieve those targets, health is very important. And I salute all those doctors, those who are working in the healthy sector for keeping the society healthy and happier, and also supporting, being a part in making India a great and Andhra also. Swarnandhra, I thank you all for giving me this opportunity. Then probably I wish these collaborations, exchange of ideas, all other things will definitely help in reducing the neonatal mortality, and also help students to learn new things in life, and also they will get motivation for choosing. They will understand the importance of the noble profession that they have chosen, and also they will get the motivation to serve the underprivileged, under the society underprivileged, and also a poor with a compassion and empathy. Thank you. Namaste.
A standing ovation to Sri Satya Kumar Yadav garu. I still can't get over it, sir. Doctor keeps coming to my mind. And thank you for your very valuable and informative speech on what all is